So good day everyone, my name is Betty Mayu Hernandez, first year college from BSN 1D. So now I'm going to perform to you or demonstrate to you the administering of intradermal injection for skin test. So the rationale of this is for us nurses or for us student nurses to verify if our patient has an allergy on a specific medication or on its medication. So before we proceed to our procedure, we need now to check our MAR or the medication administration record or the doctor's order. So the rationale of this is for us to assure if we're administering the right medication to our patient. So next, we need to perform hand hygiene. So the rationale of this for us or to avoid the spreading of microorganisms or to avoid the cross-contamination among clients or vice versa. So next, we need to identify and explain the procedure to our patient. So the rationale of doing this is for us to verify if we're handling the right patient, and of course for the patient to have a awareness in what we're going to do and why it is necessary to do. So the next, we need to provide a privacy to our patient. So the rationale of this is for the patient to be comfortable in what we're doing in the whole procedure. For this procedure, we will be needing the medication card. So this medication card contains the patient, the medication, and the frequency of the dose of the medication that we will give to our patient. So after checking our medication card, we will now proceed in the preparation of the things that we will need in the procedure. So first, we need our sterile water, of course, a syringe that measures 1 cc or 1 ml, our aspirating needle for the withdrawal of the sterile water for the skin test. So we also need a gauze or bandage if necessary, and we need also a clean cotton balls or with alcohol for us to perform the antiseptic technique, and also we need a clean gloves. Okay, so after preparing the things that we will need, we will proceed to the preparation of the medication from the sterile water and we will withdraw our medication from the sterile water. But before that, we will prepare our syringe. We will remove the original needle and replace its aspirating needle. And now we were ready. So after preparing our syringe, we will now get the approximately medication we will be needing is 1 ml. So we will get a 1 ml of sterile water for our skin test. So we inject the bubble on the center of the sterile water carefully and get at least 1 ml for our skin test. But in getting a medication, don't forget the eye level thing. For us to measure if we're getting the right amount for our medication. So after getting a 1 ml of our sterile water, we need to remove the aspirating needle and replace its original needle. So after that, we need to dispose our aspirating needle and in its right disposal and perform hand hygiene after getting the medication. So after performing hand hygiene, we will now wear our clean gloves. So after wearing our clean gloves, we will now check our medication card to verify our patient that we will gonna be doing the skin test. So ma'am, may I know your name?
Vanessa.
Okay, so ma'am, I'm going to do a skin test to you. So the skin test is for us to determine if you have an allergy on our specific medication that given by the doctor. So now we will proceed in cleaning the side of the arms. So in choosing the side where we will be injecting the fluid, we need to avoid the side where it's swollen or it has a lesion or it is inflamed or it is tender, so we will avoid that. So for this side, it is clear, there are no lesions, there is no tenderness observed, and then there are also no presence of inflammation. So after checking the area, we will now clean it with a clean cotton with alcohol. So in cleaning the area, we will do a circular motion and clean it thoroughly. So after that, we need to discard this cotton in its right disposal. So then let us wait for the alcohol to dry. And while waiting, we will need now to prepare our syringe that we will inject to the arms of our patient. So now we will get our syringe and remove the cup. So if there are bubbles, we need to do this to avoid that. So after that, I need to grasp the syringe between my two thumb and two fingers and then place it parallel to the skin surface. So as I said, we need to place only the bubble, and we need to inject only the bubble. So it should be, the syringe should be at the angle of 5 to 15 degree only. So it should be like this. After that, I need to stabilize the needle and inject the medication slowly and carefully. So after that, we need to discard the syringe and inject the we need to discard the syringe at the right disposal. So after I do that procedure, we need now to, let's assume that I created a wheel. So we need to encircle the wheel. So after doing an encircle at the area that we created a wheel with a blue or black ink, and now we need to write the time that we inject. So the time now is at 9 a.m. So I will write at least 9:30 because at least 30 minutes we will wait if there are changes on the skin of the patient. So, this time, I need to observe if there are changes on the skin of the patient, so that if it has changed, such as redness or rashes, therefore the patient has an allergy on the specific medication. So after doing the procedure, I need now to make sure that the area will not going to be massaged, because probably it will expel the fluid inside. So ma'am, so that's it. So after doing the skin test to our patient, we will now remove our gloves. And dispose it in its right disposal. So after that, we need to perform hand hygiene. So that's how I demonstrate to you the administering of intradermal injection for skin test.